Caoimhnic, and thank you, Leader. Last week there was an interview on the Anton Savage show between Anton and the Professor of Addiction Studies in Trinity College, Professor Joanna Ivers. And she focused on the rapid rise of cocaine use in Ireland, which should be an absolute concern to all of us. So during that interview, she mentioned that cocaine is no longer a fringe drug, but it's firmly moving into the mainstream in every family and communities and family homes, social settings. And with that normalisation comes a very dangerous illusion that cocaine is somehow less harmful, less destructive and more acceptable. So through my own work with Tiglin, I've seen the real damage that cocaine addiction causes, not just to the person, but also to the partners living in constant anxiety, but also to children growing up in stability and communities dealing with the consequences. I've spoken in this House before about drug-related intimidation, and a lot of that is regarding cocaine death. But one of the strongest messages that Professor Ivers gave was that addiction does not discriminate, and enforcement alone will not solve the problem. We cannot arrest all the people for a way out of addiction. So we need a health-led, compassionate approach, one that recognises addiction as an illness, a response that invests properly in prevention, in early intervention, treatment and recovery. I will say that the organisation I'm involved in, and there's wonderful organisations out there, but Tiglin has seen presentations for cocaine powder rise to 24.9% and for crack cocaine to 17%. We're now, we have a new initiative with the South Inner City Drugs and Alcohol Task Force, that we have a key worker that goes out to provide a community-based approach and a support service for people affected by cocaine and crack cocaine use. So that's a health-led example of what we can do in the community in partnership with local services across Dublin South Inner City. So by working with the community, I believe we can make a difference. I will say that people can and do rebuild their lives. Leader, I've had many of the people in this House, even in the AV room, to give presentations to show that when the supports are there, whether that's supported housing, family supports, etc., then people can believe in themselves and recovery is possible with joined-up service. But they need a willingness from the government to act early rather than waiting until we're already in crisis. So I do think it's a horrible scenario at the moment that Professor Ivers painted, and it's a realistic scenario, but it can turn into a good news story with the proper supports and the proper funding available. Thank you, Leader. Thank you, Caoimhnic.